Adaise malungili tahsils, President of Senate, Rogol Senators, Speaker, delegates, Commission area Governor, Artiang, Trigal Adra Media, Artial Banget, Ministers, Togobetsel malungili tahsils, Mora, Angiraite, Dr. Yano, Basel Banget, Material Dr. Bostrom, Dr. Hancock, Chairman of Health and Dr. Quarty, Oman, Sudan of Banget. Gida Minister Health, where below Gida Arterial Alchils, Matal Sandera, we had our leadership meeting. Evatoga change, of course, in Kodomesa, Idisera cases and Maran Morbab. Will Podaka, Bomodia, Urela, Ministry of Health. Edirigal kamama malomra se tola se toka ungil advice kadame agil ukrmeng sagil ungil advice abas kaman ngosugi der tialurior mama maloma se tiaurior der rogui giadel mo la imadri rogui of course kadaman mon mal lorior al mutmokrigi de kadam dayu se cases amran morbab ngari tial ataw ndi kadam dayu se ngari uda bangalel umra lo sa ralsil se bolsil tegi bolkora bay mogera igel togol germiu girer tiarak tama ngani ralsil maral budul ger sigida ngara igel uklada gatmok maigel maral mel masugid marung sabaklit mangara igel sedel musutri radar hospital remul smisi aurior ralsil se gimnara uk Selang menaria plan daluk tela del mite tira drauriore timlisi arandir modo urtir ma presenta senat ma speaker ma kaun mi ngamar bebera minister sana samaluk mite tira mgera ministra hel daluk timlisi arandir leng koto kloto tira do aisete ase mlongila mrerin meral alsils egida ngarsel supporter tirma Presenta Senat mas speaker agora mal le valenti lo hacen tocar adama mal ngara olbil mal sumut mas pera arad el crowd control tamagrang yegida anges wal sedel mangala committee staffer gamil uksi ilmo helper tira segida anges el dos peri alas tuiga NEC amlemit mang mara adra blaburis el no todo el mo helper tir mara adra arfel tira del mo helper tir mara PCC le open helper tir sel community testing am lari NEC nutel literal afternoon nutel recruiter araf legadamna sa barada klo a ministry gedra health and human services ospangis mang timok mo yegi de presenta senate pai paskaula adil minister bay ngotel mamul goradi update tergid margo uri la debora kermangera
sulang Mr. President malungil talial silsil murabe klad ngatya ada madengel wasem bekal silsil tobada update sel ar elon moklok ma direct ngania situation report ngome sagay sel maral morbab tegi tableda expecting malbato kan la bro la makatmok since last meeting Irikat terul toktang alon ngasergi del toktang ra CTC amla on ngasergi del makarakli segi del COVID Care Center ngara Palau gym se matlo to telelet ni dil adal ngarinya symptoms ringi ame te test sugumut positive et toktang evaluate til sing ngara treatment del mortiral sumtos pe akaring dil seldingar semestre gel Carlos pe erese sapela Dr. Bostrom, Dr. Hancock, mo delibels mo di. Masisiltan mo la kutnuklia sa lukot del community testing, laring yung sila Sunday ra PCC gym. Wigil dilo nga president, kung nga sulela Dr. Talay, ma PCC, no sabihin maskit sa gym, mga dos pairingin, mga tmokor sa igidil, free testing mo ra adrabalul. Sabihin may test ra COVID. Mung seguidra Sunday le tagtelal ma 1016 alam lay. Sabihin may radulong lela 9 AM mo declare tasil sem ngara 112 positive mong sige di ako ramle o sa Sunday kadumutan mo mok kring rakluguk o sisil ba sure ako kita sil sa taklo mo with the clock o sisil ta lagi mo mok ra abasyol sem lemor ra hospital siya mo basyo testing na bekkel sils laloran mo to kagay sa kung nakmulo sa kung ko dabang isolation hindi mo 5 days certificate positive mong ngidil atan madang al positive isolate talay mit klubasay isa pa elmer sa gidil basyo mong test so mo negative yung wal blabol lakal buko yun sa pa el resume ay gel lorura bekkel sils and then di umas kadil mutal lingil monitoring il symptoms ringi o sisilta sa gidil testing site mo o testing site tirigel day 4 test tirigel inbound madirek tirigel mamaran uspea outbound testing mungwal pol bekkel silsil la asmerel girela testing o sisil timing taligibel alleviate sa igil traffic in mortal covid care center mo o malasam milyak tirigel positive hindi tira morsel clinic er negative di ngara tara tigil testing site sabihin mo mi o sisiltayan na kadamla sel legirel step down unit ambla blood open ringim segi del ang awal covid ward ra hospital capacity ringia 15 mero kita sa pedal ko komes sa igel existing isolation ward ra hospital mero ko ngani sa igel alternative care site sa el search mo ngara o ko email ata sa el new year at one time sa igel covid ward ra lang ados peringin sa dalaway sila sing time tala 3 ata new year il covid ninggilan mo blokatak kala se tala di terurtir time new year lingil covid ul tirigel restara ada mail men new year gila langot al raktir malum sa rir ya pala sir hospital time wasing bekkel rogul ada new year gila test tir masalamin gukmat abon new year gila and test tir ta positive un tumorsi manggira maguk mo taliban nga isel situation report talman mo takila say oy tanyo yung ila covid hindi tatayla tira nyo yung ilang covid aul itay lang akuk nyo yung gira lang mo dalak tamalubang condition hindi sila mit positive na covid direkal kung nangisel aisel atilob na kasus masaya nga ma-president ma doktor mo ko lang nora era tutaw makataklil gira linggel smear madra kasus man lo klo ay sila sing madra covid hindi sa din mutan makatakil say hindi nakal madal covid aul gamle le pneumonia bacterial pneumonia gim le consult tra ngel infectious disease toktang la Taiwan ng artelo bangget madirek tirigal teror toktang la CDC am makatakil say oy even though le covid hindi nakal sa gid ya ul los meron mat di so dan makatakli sa igid mo atoran mo ang ingrid man mo karigit kay igid iway gel tilur sel announcement ra total wa semle so man misteryo te ala tulungal ko ng kan los meron sa piil kawkudong o ay sila ko dalel ng kalat direk mas kamo matamel mal sirabelo sing rahman ula ako dalel daw ay sira adrablu unfortunately guk ngania adrablu timlangi ng tel situation report tel mengo to sharing in social media magidirek kamal yonita kay ngesura gidro ko sa dit ko ta kay ngesul wala sa mong lodur adrablu malakaloro lagi gidin niya mga nauula sa bakreng ma adaktra sila community bay da kay ngesul siga solutions silgila Auriel da albang ringi. Kung dasa sige kita alasa ikal kumuri ilaltang, nga niya question si Mr. President, abay sabi edin, Mr. Te alar adam toke.
Pena wala ka. Delegate Gibbons.
Tasin si President, Minister Declar. minister akariga awak mo lang nakartiya discussion ang daw mo saying ako ra sa say if something happens sa future trigal mo sme ertel covid ang trigal sa di nga regal burial site trigid malum girin nga designated area mortir kaya sa I asked this before ada bolse ertiang sebel hoda akamaldi lamalung kora mo madangali tretele lang hindi ko what can happen in the future sulang
ang sulara gere delegate ngoy se kunda setya direct blo do southern ila last year selbo ngingel kuk no makariorm lo smell madra ko pitarang parte adul ba padangil mer mga maldir pelaw ngoy se kasuseng wal tegidel kodal makadukuram lo o niluk talmama sa igigid el protocol sergit ending balblotak kalwasel suguma ada na musme mal la musme el mat ya padangil amal gagaret el lolyo rak teling magi mingulo tirgal terut toktang to sembay kita pai bagi tirgal adal el mora viewing el tira la bai infected el morgo kayu la tolong lim kunda sa amor ka kuk nanya pala siringi ma protokol la apolo top lagi la igan di totang li la tamo sen dia kal sa ilimura di system mara adal malum mal gagalel telal sugum sa
No? Kabang hindi mo asim do sebo. Kabang delegate sa lablay.
Ang sauli presidente Jamal Bakatak velo amla mo malaswargi madangali amla mo agrilo bangkelay kalo marul. Adome sergim tiagi del Bakatak mal masaul kadmal selba akra gagi tetelawur. Abay diga tiagi del kuk pesen Omicron pitung ngarangkel. El tobadang el among emeral may mabulul adrikal amo malaswargi el adrikal mo malgol girel bay dang atyang tira toktang atyang mel so di same sulang.
Thank you. Yes, there is a new subvariant of Omicron that's been determined. It's not yet nearly to the point where it meets any challenge to Omicron yet, and most of the experts so far feel like it will not be a major variant. Minor variants have come along all along through the whole process. It's natural for the virus to make new variants all the time. So this is one of the first variants of Omicron detected, and again, there's no indication at all that it's more severe or more infectious, but it does have a few more changes in the proteins and meets the classification of a new variant. Again, right now, the thinking is that this is not going to be a significant variant to replace Omicron. Omicron is still the 600-pound gorilla pushing out the Delta, thankfully, but also, as we know, very infectious, and so at this point, Omicron is still, I think the last number I saw, responsible for 99.5% of all the infections globally.
And I think just to follow up on his question, Dr. B, he's saying, so how do we prepare us for the next variant? This is just one of them, but how do we prepare for the next ones coming? I mean, yeah.
Yeah, I think all the excellent work that Palau, the Ministry of Health, is doing right now to respond to Omicron is also going to help prepare you for the next variant, whatever that may be, right? So, you know, I was just reflecting on, you know, when we met with you a Friday on the 14th, I believe, which was, 12 days ago. the amount of work that the Ministry of Health has done over those 12 days to put in place capacities that are really going to help you deal with the current Omicron transmission that you have, and also really help prepare you for the next wave. You know, I think I heard Minister mention the outpatient COVID care clinic. And a lot of these cases that we're seeing, the vast majority really have just mild illness, and they're able to get care there. We've been able to bring in some additional new medications that help treat Omicron, the sotrovimab, the Paxlovid. These are medications that we didn't have on island 12 days ago, but now they're available for those that are most at risk for severe disease. The booster vaccines, everyone who went out and got a booster over these past few weeks, it's going to help protect them against Omicron, but also likely whatever new variant comes. And then your providers right now are you know, the ministry was able to set up this COVID ward quickly in the hospital to manage patients. They've been working closely with our colleagues from ASPR, and they're getting practice managing both mild cases of Omicron as well as severe cases. And all of this practice, all of what you guys are going through now, while you move through this wave, and it will end, if there is another wave, you have this experience now.
Para din lakpa attention mo. Sel lastel kora tingela Dr. Hancock girela sel til kalgurula neya sel mina delegate solablay luasengaria besel el subvariant el kala related mga del Omicron. Dr. Hancock se Igal lorul, magal lalu la ministra helda, ye asabel mo orawal do daira do respond el mora besel variant el moral me. Seguida orawal el tel. Di hale actually el sum dimile minister di along that line. Di ka sel predict lo sa next variant mo la severity. Hindi ka adil nga tiyang even tiraman di al sabir. Sa adil ogyer tawag nga para din di al sabir. Ang klabal kula messaging ang laka daw itutring. Laka daw magpayotring. Magpayotring yel to ya variant el waya delta maluin tel gibil hidara delta. Kada push ourselves into the brink of disaster. Siya ako tel girel tayo del toera messaging ang minister. Girel mo omes rahel in totality. Yes, tira madali COVID. Hindi ano madali hel drablo belo. Mela seleme otherwise eli el hospital services toktal available hospital la available kadamara. They're all COVID related. Mansumod ko tim amount ya yid minister. Hindi ka stopar adil mo heart attack. Hindi ka stopar adil mo mocho. Elia adam am los peanges. Hindi ka sabar al access sa service. Yes, ang makmul wasi. Ayelo ko ya presento sa NEC la mo ukpildibel. Men the serial burden. Ma logistics, ma yelgok sa members sa NEC may langay ekamim dedicated adil mo vertical COVID response open services le kodal la di kodal kada maral mer el alsil sangal para amor awlo bangal gel 7 months el di kam neta diagnosis sa to sergi samdan gel almost stock breakdown sa para amor. Maybe it's light to us mga lade al salbigik lang ay algo mes makungoy maplakwa sa klinik. For that particular ngalkol deal or say, di katal ang artel underestimated cells. Neswab ko rin yung mesra doctor niya sa alaman. Ako di balong kung nasing ladi ko di lor ko dia doctor niya lalo asem help bro. Di malang mesel ka mitay. Actually ito sila ham underestimate ra community psychiatric blue. Alak tadi ang nga ate. Ngarawul das wala. And it's that severe. Lakam underestimating. Say the typical expert ang arten din dalo ng nitial other side of the rogil tora heldra blubelo. Hindi tama dangali. Makulitro se medung segi de lolero do swe. Adakton mol electoral access ni dal sebe. He's the only anesthesiologist at tel blubelo. Ngaramang expose himself al marako. Albalabli lang tarat. Hindi gira health sector protector him because he's the only one. Makulito me, yes, you're doing a really good job on this side. Hindi kulito lo sa member the lutal mo sa other side. Le kodal la di kodal, regardless of what it is. So they'll justify. Committee na justify was yung nenungo niya. Di ako dangalin was yung mga justify tila. Hindi ba ko yung way say? That's not the issue. The issue asa kodal la di kodal. Mga nabi pilay kagil tol, lungila po da dol giren, le bluwa bluwa. Mga ada, mareng arngut. Makulito say, please, si tell ng lera adra blue, because it's real. Ika minsan arabara mo. Kita delegate ka na minsan. A mother. Sila gisalo sa aktoryano, yaro ka, proktaw. Nagumesing malo ko di balor ka di aktoryano. Di balul mesrigide, lang mes manot muramlin, o mga barang algele o mesrigide ka mga alak. That's not what it is. This is without last week.
So, daga toktan magkura malas mo understand sa mela wain gigi dat adil. Ngara what would be the best response ergi dat morning no suir. Reserun de suel malo bravo.
Mr. President. Al do suela doctor yano mal do suela am los smeller say. Di al do Babiyan Lora, Incident Commander, Sel Cotelana de los mobilize our behavior health. Bol provide a counseling il mortrigi del tour sel. Kola de torar en dir. Pues el modo mokel do ase camorens. Aquí yo me kot makla the services available. Malakal abliang algel el tour del maral matmuram lil. It just to me guk nga from nga hotel toktan nila. That was not right. For me, it was not right. Alerel Incident Commander, just mobilize our behavior health, provide a community counseling and more trigger other need those moment of help. Yakle sila last week.
Sulang Senator. Ay say, yera del la shift del mortirgagi del tira positive. So direct el kiblam related la luiga tirger rogul other surveillance am la model di lo sigir ar contact la model lo dura akora real wall police akada mo shift el mo follow up per tirgagi del me positive case di make sure nga niya access certain mortegi del service el mo korngi maral clock to telel Emerald to ko ila time magdabay bigay kertel swear other tel manggiram la mutel mosmisi isa gitu lurio Emerald mo titriar counselors el mom el bor adel el bolo dengel waset smer especially ro ngal karman magi kadin ngal el ngani isa gitu service el motti tulang.
Dr. B, you set up C4. I think it's an important point that Dr. Corte brought up, which was when you see a mother who is in despair because she doesn't know what's going to happen to the child. You know, I think because there's so much fear about the COVID, they're so afraid. So they leave, they know they're positive, but they're really afraid. And I don't know in C4, do we have any counseling that goes with that? I share a similar story. Last night at about midnight, I got a text on Messenger of a mother who was at home. She was positive, the child was positive, and the mother was positive. And they said they had headaches and they weren't feeling well, and the son had a stomach ache. And they felt like, you know, maybe this is the end. Or so how do we, you know, help those people understand? We have the care and, you know, what the situation is. Maybe you have some thoughts how we can mitigate that.
Thank you. In setting up the C4, of course, the initial work is just to make it usable, to make it, make the diagnosis, to get people on the right medicines. But as Dr. Corte points out, the emotional component here should not be underestimated, of course. The contact tracers spend time with each positive case. Each positive case is seen by one of the doctors in the clinic. So there is some personal care that's delivered, but I think this is a message that we can take back to do better about. We give information, we give phone numbers, we give Tylenol, we give extra masks. We've changed the policies to make it a little more comfortable, even if you've tested positive. But the fear that goes with COVID, we have to do a better job of addressing, and we appreciate these comments, and we'll take it back to C4. Thank you.
Minister, aktual tukar bela ko ang ila itay Dr. Cuarte. Ito situation nga niya ko tewal ngal kara ang hospital niya. Tamo close contact mit isolated team tingit trail na bangalo. Ekal bel bangalo nga bitaw limam. Atam na bangalo isang 5 days at mga test test positive. So gilid mo ito nga bangalo 10 days may ko mo test after hindi kaya tiyagid at sa kumtat makal tawal ngal ko nga ako bangalo ngal ko kaya alsel mreedel tamreedel mo diak tiarak tertira dang المرسل المال من غني قلاديل لو تليل تيارك تلما ضرب مليل ملا قلب والله يبغى الويسك المقطع كوميونيتي مليا كتير عندي إنما يطول كيس عندي تدي مرة بليرير المنستم تيجي تسيف هذه المرة بليرير الأيسوليت 10 days الفولتست السبيل مقاضي هاي ما تقطع الإنسان lubang na itel suel o isulang
Sulanga delegate will question. Dak pagungir-ngir al-garim. Akpay isip mo tiyagi na sa Tilura Clinic. Makulong dingay. January 10, ratu tao. Terol positive case at Tilura Clinic. Tilgangan no lab. No confirm na igal test mong moral positive hindi ako. Tangara lab, mga diyo mask ay gilang wok mong cloth mask ay gil di mamada. Engkal adralab mo mlibla isngir mla specimen. Latal gibin mo murim tirga ulus ngos. Todra isngir. Gigigil ngal gamlo exposure sen Monday. Hindi mlaka symptoms, all the time. Hindi day 8, nga mo positive. Emrogo day 14, mo 2 weeks longi, lengi am negative. Tial sera dakal bigulak buyo red me molto. Disel sugumo morinha symptoms, emulto positive. Sugumo ndaka symptoms, engira del mulmol tester. Leng Monday exposure, Wednesday git tester adra clinic rogo et negative, a Friday, day 5. Engel gotel morinha symptoms ringia moringi. Et mo tal Sunday. Mengkakros al bekla ada delegate. Al tawal adan klawal kakros response. Mal dagen da kabigulak mo ta klawa exposure mo tamamos me rogoy mal di yorong gel badangel gel at. And day 7 tablo all the negative. Day 10 tirablo all namo negative. Mandi so kalau ay sa tetelel at milsubing il tiam lamang reklerul sandek mong tiam mga tetelel ser. Hindi akabel old selbo niya symptoms niya positive. Sela ka symptoms yung sabihin mo day 8 niya mo positive a test. So lang.
Tia gora di discussion ding gira dela amle meeting am tira rubul belara last week. Nakama doctor hen ka amna yatte laman mitra bon trire. I think close to trila bodo dangila se tial bugu yul Omicron al dangani re lang. Ngara expectation rigid. Mani ablol do doctor hen ka diri kali agira del diri kal shelo bong gamiu. Dr. Hancock, I was sharing our experience with the Council of Chiefs because of the infectiousness of this disease, how far do we expect it to go? What are we looking at? You know, because what was discussed was some people get it in 3 days, some people get it in 5 days, they start showing symptoms at various times. It's virtually what you had told us at the Council of Chiefs meeting was it's impossible really to catch it and stop it. All we're doing is slowing it down. But to catch it and stop it, it's pretty much impossible. And what are we looking at, if you can?
Yeah, you know, we're seeing in Palau that increase in cases and the rapid spread in the community, like we're seeing all over the U.S. and other places. And this variant of SARS-CoV-2, the virus that causes COVID-19, is just magnitudes more infectious than the older variants. And so the effort to try to eradicate transmission by identifying cases, getting them isolated, finding the contacts, at this point, and with this virus, it's impossible to do. So instead, what Palau has done, which is what has been done in other places across the U.S., when there's this amount of transmission, is you work as a community. Instead of identifying individuals, you're really working as a community to slow the spread. We're all wearing masks in here today. That helps slow the spread. The schools being closed helps slow the spread. But eventually, even though you're doing what you can to slow that spread, the virus eventually is not going to find people to infect. And we're seeing that in other places. In New York and South Africa, the virus goes up fast, but it also goes down fairly quickly. And so I think that's something to keep in mind is, you know, every day that we get through this is a day we're closer to the end. There will be an end. And actually in a way that if the hospital is able to handle the cases, and there's really only one case right now admitted with COVID symptoms, the faster it moves through, it actually means the faster we'd likely get to an end. But our main goal is really to prevent people from needing to go to the hospital, and for those that need it, making sure that they're getting appropriate management. But it could run through fairly quickly. Some of the modeling says it's about a month to the peak. These are models based on bigger communities in Palau, so it's hard to say how it will play out in Palau, but we're seeing quite a bit of transmission. Dr. B, did you? So similarly in Guam, Guam has also the number of cases that they're having. You may know they're in sometimes 800. I think they had over 700 reported yesterday. So they're having a lot of cases as well. They've shifted as well from trying to do individual contact tracing and isolation of individuals. It's just too much for them. So instead they have the mass mandate. They've kept schools open. There are a few school systems that have gone to remote learning in Guam, but they're going through. And I think the question of Guam is a good one too, to look at the number of hospitalizations they have. They had been at around 20 hospitalizations for all of Guam while going through the Omicron. It's gone up to 30. Despite those numbers, it actually, if Guam continues to have cases in those numbers, as people may know, Guam is about 10 times the size of Palau. So if that trend in Guam continues, it actually bodes quite well for Palau, meaning that you're not going to have many people admitted. It would be on tenfold of that. So it'd be like only 3 patients here in Palau. And you guys have better vaccination rates than Guam. But I do think, for all of us that have been working, and I know in the ministry, even though there's those good signs and things are, the end's coming, they're really doing their best to, prepare for the worst case scenario, which I think is responsible.
Minister Maldi Yakadebe, Kadamatin Lase Man Namo, I say, Man Namo Toka COVID positive Blue Belau. Doctor ako amlo mention ay gale local services ako amlo tarakra udasyo kasi silgo program margidra referral lomon gala Taiwan sing di mo ngil basul lang sing are we still good with that ang wakana
Silong. Kung das el altam sel expecto la sing ada kas kogil mara Taiwan. At least in telal Sunday si decision el dim letir el ut maklil based tra situation er velau ma direct el Taiwan. Kalau tu tele lagi pa mo besering ila sel sugo monguk mo niya adlo spell mora referral ang ra mo alternate tele lendi o sing edel ang ra Taiwan o sing la close at least in ngirung edel Sunday etira ko sa edelo mora referral.
Maldigega Bagri. Suppose cloring Ablal answering his last statement to Dr. Hancock. Although saying niya ulel ma peak masel go chloral ma agregat raft ma waigel dilung ngladir ga mal early kerdir ngara ulel el dial seped los pe aikal ur lol top da ministry e kora malang alwase kada moray gigi del steps ra lawak lang matelang ra 6 months kada laul da lak ngil tarak or more. I know it's very difficult ra way gigi del tol sabay mo tong ending akora dioger el wase pastry gigi del ural mel motor el alsids ngarnya ko rasubel lo melang ergi lo se kadal almutel waisel tarak erura ya omirul question nga ka se tial kada confirm lo se tiagi del COVID al takay ringia Omicron. Sebenarnya direct confirm wasing hindi akadil Omicron. Ni may gigidal bebil ra COVID al dimlangar ngi adang malditi ayidi. Musulang minister.
Sulang. So, Dr. Hancock, the first question is, we mentioned, there will be an end, and you mentioned the trends in other countries, bigger countries, of the timeline that we might expect the peak. So the question is, what do we foresee based on the numbers we know today of where we're at in that sort of expected timeline? The second question is whether or not we've received any confirmation of the sequencing of what's circulating in Palau, and are we confident that it's only Omicron, or is it Omicron and other, perhaps other variants as well?
So,
Talk a little bit about
all right.
Thanks. In discussing when the peak will come, we can say that the COVID Community Care Center, the C4 clinic, is still finding that the rates are very strong. We think we're still going up, still on the upward side. Maybe would expect that probably for another week or so. Again, it's so hard to tell. We've never experienced Omicron in a population that is so well vaccinated, but has never had other waves of COVID disease before, your first wave. So this is new to CDC. But from what we're seeing, the numbers are still strong today. Well over 50% of the people we evaluated tested positive. So that number has not slowed down yet. So we expect at least another week of growing numbers, and then we are hopeful that things will turn around pretty quickly and go down after a couple of weeks. In terms of the evidence that there's another variant here, the information from Delta outbreaks does not show this kind of spread. This is very impressive numbers of people with what appears to be a milder illness, even though some are sometimes frightened and feel overwhelmed. The illness seems to be shorter and less severe. It behaves like Omicron. The samples, I believe, have gone to CDC, but I have not seen results from anywhere in the Pacific recently, and we have had some conversations telling them that they need to prioritize those samples so that you folks know exactly what it is. But we're still quite confident from what we see that it's Omicron.
Just a comment that, yeah, CDC has received the samples. There's email chains, so hopefully we'll get some results fairly soon for here. But and Guam did confirm that they have Omicron there as well. So yeah.
Maybe Dr. Hancock, a couple of things you said when we were at the meeting was Omicron squeezes out the others.
Yeah, so first off, the chance of Delta being able to get a good foothold here in Palau and spread is extremely limited due to your great vaccination coverage. It makes it hard, especially with Moderna. It makes it hard for Delta to spread. And so, as Dr. Brostrom mentioned, Omicron is able to spread to those that are vaccinated, but it's hard for it to cause severe illness. So the fact that so many vaccinated people are being infected here, it's definitely Omicron. And then what happens is after you recover from Omicron, you have additional antibodies and immunity to fight the SARS-CoV-2 virus, even Delta. And so what we're seeing across the US and across the world is that, as Dr. B had mentioned, it's a 600-pound gorilla. It really spreads fast and can get ahead of Delta and in a way push push it out of the community so Delta sort of starves and can't find people to infect.
And maybe we could talk a little bit about the burn rate and what Dr. Fauci, if you can share that, because you talked about it.
Yeah, so, you know, I know we've been saying that Omicron is much more infectious than Delta, and so it spreads easily, and it can spread in vaccinated individuals. And because of that, Dr. Fauci was saying, hey, this is going to be a hard variant to hide from. He felt that there may be a point in the U.S. where everyone at some point has been exposed to Omicron just because it's so infectious. And so, you know, we'll see how that plays out in other places. But as I mentioned, a lot of those interventions that we focused on individuals and contact tracing that we had in place for the previous variants are not useful against Omicron because of how easily it spreads. And so, you know, we want to slow it down, but it's going to burn through.
And then I just wanted to add one more thing. We've had, as of today, we're going to be over almost 900 cases that'll be positive. If you do an average of how many possible contacts that case would have, let's say it's 7, or we're talking 7,000 people have already been exposed, right? Is that some?
Yeah, I think as more and more people, more and more infections in Palau, and especially as I think you folks, I think probably everyone here knows someone or has a family member that's either been exposed or has caught it. It's no longer clustered in just one area, right? It's all over. And so it starts to spread, and it makes it difficult. If you have to quarantine every time you're around someone for 10 days, you know, you can catch really Omicron probably only once, you know, maybe once a year, but you can be exposed multiple times. So if you're somebody that was exposed because a coworker was positive and you had to stay home for 10 days, you could go back to work 2 days later and get exposed again, and then you have to quarantine again for another 10 days. You can keep having to quarantine. And so at a certain point, so many people in Palau could be exposed and quarantined. It's really difficult to keep things going.
Okay. So contact tracing is almost impossible to administer. Why bother? And then we're on the receiving end of testing. Why bother? Why don't you just, somebody who's symptomatic, you say they have Omicron. Why bother? Because the health workers that are being exposed, or their time, maybe there are times when you actually do test. But if it's so rampant in the community, why bother? And then a question more, Dr. Hancock and Dr. B. Besides the kind of clinical response and the epidemiologic response, are there social policies that would actually lower down the cases? Because in the Philippines, the cases in a day was 29,000, lockdown dropped to 14,000. So are there social policies? I'm not saying we're going to go there. I'm just asking because all this time we're just assuming that we're going to get burnt out and we're going to wait for it to infect everybody. But I think we need to recommend other policies that possibly could actually decrease the burden. So I'm just throwing that out.
So, thank you, Dr. Corte, and important questions. I think your testing suggestion is one to really to consider. The one group that I think we really would want to make sure we keep testing are individuals who are high risk and would qualify for interventions that could help further, get treatment that could help reduce their severe illness. So that might be a pivot. But anyone in Palau who's over the age of 65, obese, or obese, or has diabetes, or has high blood pressure, or heart disease, or is overweight, those are all high-risk things that we would want, conditions we would want to test for. And if they're positive, they may qualify for one of these therapies. As far as community interventions, I think you're right. There's larger interventions that can be done to try to slow progress. A full lockdown might slow it down quite a bit, but if you reopen, that virus will just come back again. But I think one thing to consider is, what are activities that put our most vulnerable at risk of exposure? Those are the people that, you know, we really want to make sure they don't get exposed. And so that could be, you know, mass gatherings where a lot of older folks are around, those sort of things as well. But I don't know, Dr. B, you have any other?
It is such a difficult question. It's hard to know if you lock down, and it did turn the caseload down, although we know it's in each one of the states and at various levels already. It's hard to know what the lockdown would do at this point. But it's hard to think about then eventually opening up, as Dr. Hancock mentioned, and wondering if it would be any different. The important thing for us here as medical epidemiologists is to assist with what's in front of us. So while I appreciate the question, you know, clearly that falls on Palau to make their determinations, and we'll continue to try to help however we can within the decisions that you folks have made. Over.
For me, President, I understand that. I'm saying that I think those possibilities or those recommendations should actually be laid out, so then we can choose. Yes, the way that we're planning to is to peak in 30 days and hopefully come down. And everybody gets infected, so therefore it kind of gets burnt out. I understand that. But you can also look at double peak, meaning that we limit the mobility, not necessarily lockdown, but we limit mobility to slow down the peak, so that when the next peak, that hopefully will reach all the population, can be well managed by the teen health sector right now. So it's a decision on whether we're going to go through it once and then suffer the effects of that one time, or have a double peak, which I think is, and I think those recommendations should actually be laid out, so then the policymakers can then decide which is better to fit the situation that we're in.
So I think that brings up an important point, because what we've done is we've closed schools. The idea for closing schools was to flatten the curve. Now the question is, do we put kids back in school next week because we've already leveled it? How long do we keep them out of school? If we've already taken that strong measure to limit it, because maybe we would have over 200 a day if they were in school. Now that it's coming down, maybe we need to continue and send them back to school. So, I mean, those are what we need to look at. And then what is classified as overwhelming the hospital? They can't take care of what they have to take care of. Maybe that's something that we need to understand better. I mean, if there's only one case in there that's a COVID patient, because one of the concerns was we're going to run out of oxygen. Well, if we already have almost 1,000 and we only have one patient in there, if we had 20,000 people that all got positive, that would be 20 patients. So I'm just, trying to, maybe can help on that.
If I may add to that, Dr. Corte, in the clinic, we have seen a remarkable number of people that attended mass gatherings over the last weekend, were often unmasked, knew exactly where they had been exposed. So I think maybe that just takes more time for folks to take this more seriously in these important social gatherings, but it is a difficult thing to change.
So maybe next week's policy, I'm just throwing out there, is we need to stop funerals, close the bars, massage parlors, but open schools because kids are going to behave and wear masks. Maybe we need to reverse the policy.
No, President ang noswing hindi ka necessarily kada mura lockdown. Global gula ada decided was assuming nga flu. Kita already kada mura was kita doctor yan. Hindi ka angot ang alsel bela doctor al time flu. It's only this. Mungkal ngidil adal met mo you just assume it wasn't tiyidi. Unless ang gamil mal symptomatic, then of course the test and then follow through. Hindi akong das when daktulo sa testova funeral. Hindi ngirel moriya effort rigidel try limit ra adal ngara close area just to slow it down lang. Alsum pa slow down ringi. Ang most of el ngariya capacity rigidel. Again ako mo morsel side argument. Hindi man COVID case sa ospital at alam mo kasi access sa regular service. So, kada set ya mild, but we inhale also behave like marura ada panic because kada mong mild alternative matira alele madril was well there maybe they're not telling the truth. Yang nga madudul toktam. Malsuma ya ikal symptoms sa mild. Ede angod of course al other ingwita doctor yano there no male. Celebraria symptoms you test positive. Mga elite, ang layak question kasi makaramam din sa ada assume that he has COVID right now. Just assume. Your next Minister of Health Motora TV. Just assume that your next person is COVID. Makumda sa kadabay gila more sayid, base legal recommendation or T. Come up with a better streamlined policy. Malakal sa stress lang. Ako lang sa sangarian nurse sa kumulda aborrere lang. Dedicare hospital. Let them doctor hotel morabli. Understandably. Makti duli se kung sa ngayon inconsistency adol ko ni ma behavior gid maul ma adrablu mo ni se gid confusion.
Sulang ya senator. Umdas sa point tamal wel teged gira del mon mesering ti soal multel morsel le qadim gira la testing no se why bother igi direk kem lo mesering hindi tokar adal maqdong mel se so mamal test agim positive magim negative nding so mamal test so se gira direk ruul maqdong mokra a testing ler ada sel anxiety tira by move to mokring ra of the swir rabol positive result. Ya babirtir amle positif, egil butiak lan dia ka symptoms mong ngora gira dal malasam al balance at ko lasing o ya tang mo resources mo hindi agi direct from das sa egil sa bokeng lase ngaka positive malubon dia mong era ka mo meseringi lase magara dali tila egil streamlining malbol tege bel beotra rogulat.
Ako sa da oya sira sando ko no mass testing. Malda among the linger adal goal ng anxiety and septism testing. That's fine. The purpose of mass testing. Why are you doing mass testing? What are you trying to identify?
There are 50 lada involved in operation. Most part at some point, and get stop mass testing. There was a term more routine. Kamora ER, you have symptoms and some test. And I think, because I'm not announcing, saying, Kluga the Maruri. Think I get the decision that Mamrek Segi that they got the root and Maruri. I get decisions because we're wasting resources. And they were taken at test airport. Ineffective, the order, stop it. Yeah.
my apologies, because I don't speak Palauan, but I think there's some comments about mass testing. Why are we doing it? What is it for? So I think, while I think there are some benefits to mass testing. One is, it allows, we know that this virus can spread and in people who have no symptoms, and they can infect loved ones even though they feel fine. And so sometimes for the community, at least other places, and it may be different in Palau, the ability and to go and get tested if you're anxious about whatever it may be, is often helpful for the community to have that ability to get tested if they want to. The other thing is it does help identify additional folks that are positive that then go into isolation and help slow the spread. But at the same time, understand if resources are limited, the testing of symptomatic individuals, especially those that are high risk, is really the top priority.
And again, this may have been discussed, I apologize, but at the EOC meetings, it's really clear when we hear from the comms folks that the number one issue for people calling in is they want to test. And in watching what's happened in other countries, that's some of the anxiety that comes from the public is that they don't have access to the test. Dr. Corte is exactly right that the testing is not going to change the shape of the curve. It's not going to increase or decrease the number or how this virus behaves very, very much. It's really a public service, I think, and that's sort of how we approached it. Palau has been able to acquire through their own ingenuity and through some donations from other countries enough tests to provide the service for now anyway, for those who are seeking it, but mostly as a public service.
Maybe we need to get to the point where if people want to just self-test, how do you feel about that? Can we do that with these tests we got?
Unfortunately, I haven't seen the setup of all of the antigen tests, but at least for the U.S. Binax that was donated, it is, you're not able to break up the reagent so that people can self-test at home. That being said, I hope folks are aware that Palau citizens can order those home test kits that the U.S. government is offering. So really encourage people who haven't yet going online, ordering those. We're not sure how long it would take, but it would mean that every household, every Palauan address could get 4 tests, at-home tests for COVID that they could use at home.
President Iswal ay sa kaitul comment. Imora malgam klinik positive kilo tira teilad. Terur tira ngalga ma dalal ma biil ma in-laws. Tetetiul adang mara imol blay. Arangal kam los mer emogil. Ngal adralabam los mer emlongil. Abil adim lakabolser. Ma sister-in-law ngim lakabolser. Etirga kira imol blay. Adral chlorodyl am los mer ending mild symptoms ertirmo. Delegat ramalgo tangaringi a contact rasmer el lakabolser. Ma naguk imong direct abilam los mer ang algelam los mer abil ardilam los mer adil di dama de nabolse mendiago dunglia behavior tel virus mutiang makarang endi tangra imolo blil abiritira mos mer abiritira nabolse expose.
Delegate Puliber.
Ilal silse president kama minister ma. Sige na meldong lo se magigil home test kits available ang bigil. Sige na eligible. Kung dilo kung sa individual order, dingil order. Minister ka lang niya, te al sa edel, ugya, obisa ka mga presidente, mula sa el, kabelmento, o lingit mga other bela rogoy. I think in that way, more reliable, more, sa el, mula sa el, makatmok, mawangil. Instead, kung al, dingil order, test kit, niya, limos pa el, package mga other bela, karatim kasay, 20,000 lade. Tulak.
Sulang delegate. Iregi mo omesringil sing la sa el wal til imol ordere kata luba at least dil vera hospital sa etan maro sa iging. Iregi mo omesringil sa wang ranga tetelel sa yan kung dasal ang niya bebira restrictions or sing di imol order mar imol obli ng rakel. Iregi mo omesringil sang tu mga niya telel put makli sa igito.
Dito, ay sa Taiwan almer loyalty. Test kit sa mga American na kamay sa sim na terablan sandan na.
Oy say mong angara at least ting lui me ay mal mabdul og del tela le teskit sa gire del sa del lo la per la ta mendi adi problem sa gide lo sen dial sa del mros lenguk ter li gide del home kits el individual teskits wal aring gide el solution el gide del spering la tela teskits mo era gi mo mesring lo sen magara ko te alla gide el individual teskits sa del mos el maro obli ndi di sala teskits el tola per el ama igil de expect el mera igal meral mil sande amal betok.
Sami president ko diso lagi ra Dr. Yanol Basaya. Salamdullah sing los meren. O tirgal imol tulungan kal no nganya positive tir nganya mosmer mada bolser. Amos meron bulgulak masing positive adang los meron lo nga symptoms ringi adang le positive hindi ka symptoms ringi ang gura bols el mo clear basing nga positive mga ras meron gura mo confused sa coming senator Dr. Yan.
So, Senator, ang gura traitor. Ako tul balang malasir ni ako karon mo gol amor golir mo ringa talgiban net sartir mo ringa klal bebela mo ringa perir tara direct mo ringa symptom ako ram mo masaula hindi ako bolok tapay di mo ringa taisngir tadi ngarablay melima ilum melima ram melima Tylenol. Hindi mla kamura hospital. Monyuing di mla tegang mikarangal ka di mla kabonyuing. Hindi mla kabolokluk. Hindi kalokluk.
Masalam daw sa tinakabolsera tamlo positive hindi mla kalsera.
Loringa rak tertir, loringa rak to. Hindi mla bolsera.
Di Dr. Ono mari trigel mura sir mura imol oblil even ma positive man dia. Oishi.
Kamlutul makatakli kamlutul.
Ako rin report nga sa sukumang kadunga population ng ari o kodel basen tertigem la fully vaccinated and booster da ala dekal sinu tiarak period dekal dekat si mas tiarak tertemak. Aguro sa trial no dekat bolseran temle positive hindi dimla ka bolsera atan dimla ka positive.
Ang dimnakabol positive. Tirgat makal kay. Ardil amosmel adil. Mangal. Adama diak. Diakabol positive. Diaka symptoms.
Well, akong tasasal kotal mataktar nga raata, akong tarak tal morablay, nga ni tirgay tal ko talgibal itu tabangir na mo tal malubetuk bebirtil ko ra wa ko ra NCT wa ikilulgot oktal mas tirgay tal ko high risk. Chlora population ar kita ngar sa ikital high risk ulmar ada malmatakta mang hindi ako na sa mga definer saying thing, I hope adawela bolungil understand nging amo dia katasal mal waset rakta mal nganya klol rakta long si irgida sumhatungu. Ang ko di ulmak ko uligera say ma suman sa pedal ko mo clear sa igideng mal ngusutriar at rogul mo sa pedal mentally deal with the COVID Del Omicron. Sulang Dr. yan.
So I guess the messaging from the Ministry of Health throughout this past year has been very good in scaring people that COVID is going to kill you, right? I mean, I think that's the fear. So when people test positive, that's the fear. We've had almost 1,000 cases. We only have really one in the hospital right now that's COVID related. When do we change that messaging to give these people a little bit comfort that right now, this is what you're going to expect? When Dr. Yano made it very clear, you might get a sore throat, fatigue, a little bit of a temperature. I mean, can we say that to the public so that the public feels confident that that's all they're going to get? Because I think there's a big fear that I test positive, it's the end for me. Or, anyway, thank you.
First on this one, also message ra ministry ra held. Social media. So umaktak tertir. So mang girela ministry ra held el tone down emo o change a message tertir according to the available variant. Maul makmilokol was giring nga intelligence. So mga masingil 2 weeks in horizon, start talking about it. Nakamongin more sila kasapak level mo because are already they know what's on the Omicron now era about Southern they already are Adam Southern was nga South Africa. So girela ministra held pre-entra social media maul mag-global gula i-osil ba niya intelligence niya mesaygal maral may mas il-tailor a message yung tiril mo ate. So kung opinion na.
Salamat, President. Ako urang sa aldo yung ay akora mo malat kay gal numerical experience ng akara. Kay gidil dakte ar other belot karakta. Ako teng kay gidil sil testing mass testing el bled conducting ni. Tangariya butok la other look forward to it. Ang ilang ang trim na mo lelaktar ni Rosia Kim na tested mo na solve cell anxiety level tira ku testing issue mong setara kung dasong we need to look at it Rosia le tangariya di real sorry mutil tested just to prove the case ela tangariya di real vaccinated ak mga tiro sa tangariya rada di real vaccinated ma message sel ku podo ora target tira di real tara issue le triye ya bay mo issue gira are blood vaccinated. Maganda diri ko lomda sulti. Arangal gara school, material ngariya igal social media ra school ko chat room ra parents. Ngariya igal ko information ra social media ngun mel mi de clear tel chat room. it's scary lang. Ay mating sa hindi kalto dra public health. Kung tingarak mong gerel mail o mo trira adam cellul ngonya Dr. Cuarte, I do believe was in. It's about time al gukto mes sa social media. Streamline na communication ra ministry health del lomes was in makrasbe del maklar ngrira adam medical del social media take over tiyan. Omicron ra sa Palau. Yes, social media tara issue mong we have to do our job to slow it down.
So I have another question, and I think since you're here, I'd like to ask, and that's, so we've said we're limiting services like surgeries or other things from the hospital. When can we go back to doing that? Because we don't want people to die because we can't operate on them because they have appendicitis or something as simple as that. And why can't we do that now?
I do believe that emergency surgeries are still being done, so including in surgeries for individuals with COVID. We did our first, or they did this first delivery of a mother that had COVID and a beautiful boy yesterday. Appears healthy, and I don't know the testing results, but things seem to be going well. So the hospital does have to move on and continue to provide care. And I know that NCD's clinics have also been curtailed, and I'm sure that is of great concern. To me, Dr. Hancock probably has better thinking on this, but to me, it may be another week before we really know what the impact is going to be on the hospital. But by next week, we should really have a much more clear picture. Right now, it certainly looks very reassuring to Palau that due to the vaccination rate and the fact that this is Omicron, that Palau may be able to get through this quite well with the minimum number of people that have been hospitalized and a minimal number of people who may die. So we're obviously optimistic, but we would not expect the full force of hospitalization to start showing up until next week.
Monsieur le ministère, au matériel docteur le vengeur la seule. Quand tigel nine la admitted le ministère hospital tigel tamla receive a vaccination. Like mlaringa for first masing na vaccination nga mosme lang.
Sulang ra agit hindi aksan matinge vaccination status at tirigan 9. Kung das nga niya baby tiril diri ka kal vaccinate. Nga niya at least ng one unvaccinated. Kukumle mera amle New England gira latara condition tested positive mo. Ak matinge singa niya at least ng one unvaccinated. Mga niya kaya nga kalmle mlon New emlat taying. Well, of course, ang ngari original 5 mamle unvaccinated. Hindi yaksan matinge status at trigel bebil hindi sa edel mo ay suru.
Hindi kami policy kami for anyone to be admitted. Kung mo testing il wasing COVID or not eh.
I see.
Okay. Dia minister ako te tamal mga sulem. Kau maram the message number I get a daily update. La kaluda elig dul mes en namne 691 say a number dul mes so kad matingel wasa ureriu adi kaloral mogobgak adi mandra public asoril lego adi kal mala service tira sometimes en adi kalkin moda kasi iruli so ngomu la monda community yara ada amamsa ada tol toy di nga ka sabay concern niya tial kami or other hospital Kasi maybe kung man na mo overwhelmed because of the number of the cases, sila domesing lakal within na igel maybe the government igel relevant agencies would join force with you lor kasi umil giret jalur. Kalau ba ibigay kalwasing kalil by the overworker that or end up maybe workers hospital mo positive mo dia kacho isirgit matumal lor. Di Además, hoy en el gao maradam, el gire la ureriu, may garo gul effort el moru, lendi kitambral gire del grigik tungkora. Kida was under impression was gadi mokmedra adel el positive, como ngu disel doreng sa doctor yano engel el mas el lesme ending guktigel adrabla dim na bolse, ang namal di moyor ar adel kwasing gukwang ranga patingil. So, akpal sige dawa akpay concerning ilwas oy komal masal mo rin di kita bay bigik kaya kumiwa abom overwork del bay full morning problem. Lastly, ang katokor omes tiga terul toktang mabay I'm sure that tiga they came in from a destination maybe in patoka cases of COVID. Di mal, we're very happy to see them. Maybe what's their secret to keep them from getting the COVID? They've been to places where there's a lot of COVID, and maybe it's a useful information to people of Palau that you do these basic things and you can stay COVID-free. Thank you. Yes, Dr. Nkak, we know you're traveling in from areas maybe in Guam that there's a lot of COVID, and we appreciate everything you're doing here in Palau, and maybe some of the basic things that you are doing with this meeting, maybe you can say so people will know that you can stay COVID-free if you do these things.
Yeah, thank you for the opportunity to share that. I think first off, getting vaccinated and getting boosted. And also for me, for my family in Guam, everyone that can get vaccinated and boosted, that's been the first thing. They all got vaccinated. I felt like when my wife could go, my son, first day, I'm taking them to get vaccinated. The other thing is we're really careful about being indoors with other people with masks off. So anytime I'm in a setting where people have masks off and it's indoors, I get very nervous. So I'm always wearing a mask indoors. Outdoors, it's much safer. If people are together with masks on, it's better. But that indoor setting with the mask off is very, very dangerous. And so what I realize is when I'm at home with my family, it's hard for us to have masks on while we're together. So what I told my family is when we're together, this is the only time that we will be with other people indoors with our masks off. If I go to work and I'm with people at work and they want to eat lunch and they want to eat lunch indoors, I won't do it because I'm afraid I might get exposed and then bring it back to my family. So for our family, the only time that we would have masks off while we're together is with our family. So that's, and then of course washing your hands frequently. But that's really what I've tried to do is make sure that anytime I'm indoors, I have a mask on. I don't know, Dr. B, you have any secrets? Oh, yeah, Dr. B can, yeah.
So as Dr. Hancock had mentioned, really, those are the basics, and I think sticking to the basics is the important part, right? And again, in talking to several folks in Palau who've gotten COVID at that clinic, and we've diagnosed, looks like, almost 800 newly diagnosed cases, that folks know that time when they were together, indoors, sometimes even outdoors, and the mask came off, and the stories were told, but they knew that's when they got the COVID. So when we talk about the masks, we've done a couple of shows, I think, the other team with us, the ASPR team, has done some episodes of the evening discussion to talk about those masks, and N95 certainly is the best and the one we prefer. And it's really important that that mask fit tight on your face. It's not always comfortable. It's amazing. You sort of get used to it after a few days, but it's not fun. But again, this is for a short time, we hope, in Palau. So those are the basics, no secret, unfortunately. We can look at healthcare workers in high-risk places, in New York City, other places. And most of them did not get COVID during their outbreaks, even those that worked in the COVID units. Some did, of course. You've heard about those, but most folks, if they stuck really close to the masking and gowning, gloving, even the hardworking Palauan nurses in the new COVID ward that's gone up at the hospital for those patients that have COVID, I think they're very well protected at this point.
Thank you, Doctor. Now we know there is no secret. Everything that public health has been teaching Palauans is everything you said here. I'm Saul Minister, Dimlesuar al-Gukori Segid al-Ger, at Saul enlighten us with the information of basic things that they do to prevent them from getting the COVID. Pagmam sulang ay gal rogulo sa tirgang at bela sum torrents, it's everything public health. Also sakal gidrabe kalsils, o mask, molata imomu, get vaccinated, all of those things. So there is no secret. We just need to follow the. Ma'am sulang Minister.
Sulang Delegate.
Delegate Kanan.
Sulang Presidenta. Speaker ka sila tang artial kadam lo kara signing ceremony emro ko yakim lotur hospital mang yakim lotur el dire kan dorsal facility ngani tirigel el COVID sesel el step down unit yakim lo maliwek karingi speaker maki maliwek la yakmal kora akmal aki kora akora bagi kluasay Gidi lakal ko top tayo talmer kamamaling sige the president taman na ul swek kasi gidi lakal ko top tak mongoral el merikide makul ke ramun a doctor kwarte doctor yano luasay adora tial meliwek karingin diakal ko ay muler gid eto asen diak ul makoro wai satyang pero sila po de ngalaklara ay ke room ngani trigel smer etamal ko smer sel kumesatir. But anyway, ngora rula ke minister mo ogere luasay. Ako das information adanga tirgai dal smere lang. Adirgal asab el mo sugi dal loais el morabuay luase kalsak la. Ay kel conditions ng ngaring lang. Asab el mo contribute al mortial raktal bomngul limu el mal mo imis. Ngaw kaya kor omes yasay. Kam korang sabi emelo ay sa nyuing elang. Ngaring condition sa tira ulmata cerebral positive al COVID positive ta mosme el nyuing leng naring segi el kora akaikel condition sa tira niya alilutal contribute el mortial niya ulmang malmo. Kung da segi information na sabi el president takmal umral wasay yang al-amral wake up call and merikit. And maran namo kire dal wakel kora mo follow up sel kanila delegate nga along. Namo kire dal maran lol si sa akrar nga lekit mabalur belaw wase both healthy both eat healthy the lifestyle er gida bol warang man depende trigay the new minister tirgeta ulmat tanyuing until nga rin ang condition tir ulman dire kal mo contribute al mortial mo ulit mo nyuing mga kumda sige kita dire kal adra peluang pa nga raul bululwasay kita kata sabetan mo smeret yang because ang agi dal nga rin rakter mal ubeng Hindi ka da healthy, amin ng buong buto kay kita raw ring artir, plus tiarak ta dimlaw ulel, ang ulmar atang malmadakta. Our nurse martoktangal me etekeregi de Senator Inavo, away lay kay kita kurang mal mag-clone bahil. Di ka mamamlor tiya seng C4 Dr. Yano, tiya facility gibloringi. Ang maral rangal ka marmaas, luay ka lor ko Dr. Cuarte. Kaya di o Mr. Sir ka di maral mo mahitar ngudar adal, tirka panik, amin tirka pa nervous, wadil bol ngay kaltesta. Leng talawas yung ngidi gibo ngay kaltesta, gibo mo tingin luwasay. Akismer, malub, ngarinyal ako ra symptoms dertir. Maul makura ulger tayo ra minister asay, maybe gaya information ginit tiragi den yuing elang asab el direkal man mo help in so many ways luwasay. Other Palau bol karikikla sugum direkal niya teal el bol live a lifestyle healthy o sisul time ebol maklaran dil wasen diak tiarak takuk tiak dil beotan mas adal angya ngaw kaya kor omes tirgal ngaringil ko ra ngaringan makadalbuye inabo ma kor mal madal smer bakora moran raktal amran mortirgel albortir en maral lo ko makamia adan mosmer kam ko minister wasya yel data blam ngai hospital gir tirgai gidang enough educate rabway mamutamos tel gibel cool off amin ko na mo cool down mo dia kalsan mal bakik lal gire la awat yang doreng serelang yang kora tia kora di wal trate telel kam ko ro ise minister
Sulang delegate ngway gel tilong lasing tal atruy el adan yuing el sel word el angling te infected hindi imortir an yuing el covid au ul of course adal mon yuing al adal salmal gora ngila chosringi mate sang mal gora sme ding say giding o masinder tiram len yuing el girela ay kay gid pre-existing el raktir hindi the tester tir ta positive maun tan yuing er say giding yung mondia kal positive ra covid at tinga regular word el new yung el gida lagel kuk pre-existing conditions at ti mong ngoy sa deliget tungkol at ti di plakatak ko se oy tia di mild lengan yar atal mo so in mo hidols me el mo niya ko dal landing kung talgibel maring la to makpiyot ringi dal gida lo makpiyot ringi hindi o masindra tirgay gitil medel ayal dartal adal mlamo matang alwaset ta positive o masin tira tiaka symptoms tir malubal ngaringi hindi mild
Sulata ni Presidente Minister Palau akti hospital mutul kora mo clarification ra igel blem share early gile langgel dal mamal blospe early ko alak alwida diluk mong dial ko bitaw ula raktel ngoyal saygid el raktel el rol ni giniya amle ul mak ti ko amo confused la se saygid el mol gonil wasing okmoga tobda sel el cost of tedra certificate ni sel official record ni yang siol wasen seigit rektela siamle ula hotel lal ubeng ngima covid kabam enser se
sulang delegate nga kadiak toktang mung dakal sekon malkoraman mo kumakail smoothie hindi tagi daw era kibom announce agi bilkodongya family member may mengel toktang almle attending physician serabul alse el mother say gid covid ward yung ultuira discussion matirgal sa litra amrigel mataywang doktor kilo sendia kal covid daw ula ko dulnen ngang amle sera ben ying already ngaringi kan respiratory infection ringi hindi mlo COVID mong oing sabi adal wasing amlo ngariya interaction ngaraken nanding selmora official certificate death certificate toktang ruling ringa sendia kal COVID au ulmam la
Adik follow abara metro sisul issue. El hace list tergumira tirgel doing under report tergumi mas statistics sa COVID patient. Ani tigay kita nine waset well doing. Tigay ang dire kalau sisul guys al ubeng ngani al baby retin doing el COVID awule tamal smer maten doing.
Ngay sa ingira mal mo makatakli sa liya pa mo top the cell si trip plus altat 3 elat hindi imortir el alta ma COVID au ulman yuying. Tirgel baby la an yuying lang ngaring ako tal raktir hindi test positive ra COVID. Magi kung das al silsil mo ngira mo makatakli sa gid. Hindi ul mangira mal include ngira situation report til yuying COVID positive. Hindi ngira mo blakatak los tamal tel artiran yuying ilang COVID au ul.
Di kay kita sulang.
Adimle ora last discussion kami sa ni Dr. Yano, Dr. Corte ora mo do shirgire la school. Das namawil tamer do open a school ada kadal mut long lil tal chande. Kadora terumi on self observation kami. Kabong
Sunod Presidente, tilagi na kalukok mo, kora diri kal mention ringiling. Kora malat ka, ngalaya kal diri kal vaccinated. Kura amna argument nga ka mamas nga kanal offer vaccine, el dulp mas hindi ka pwede kal vaccine ang gugulong mara ka selta masing. Ngal ka mga nila immune system ringin sebel. Hindi ala lukok kal salman na mo close breath, kuk tulugi ringin masing. So, I guess a decision na rin lang akmase mong lakal vaccinated del math. Mal vaccinated del math. Le sum hindi kal vaccinated math eko adil aman mo klo barra rum. Le laon das akmase kul dinge blo vaccinated. Versus rablo vaccinated del math. At least ang aring sir ngum akmase. Akmulap kuro babal sabi kal vaccinate ra kaniya hindi ka aldo ula lang nos me. So ay kita tul ngarap truk sel sum ko masir open school. Kasi kita ngarap ng real parents. Nga uktom dasok masingire lang aliya kal vaccinate dala kada follow el protocol ra professional sel durgid. Gire del vaccinate ng help pergidra. So say kita ko ra direct ra Google de sugra to ra open school. I would say open a school yang lagi kal vaccinated yak malmol malas kala education kung masih memel ngarablay until mo vaccinated el ngarayel tretel la school ablay sulang
kira manual point maybe minister ka biskila update regel vaccine ra naman
ay say kita ko ra ulureng lasem losa pa Elmera last week. Di unfortunately mo dakat sa PL mong hopefully miracle ko hindi ang lasam confirm na singgirin miracle ko mas schedule start tra Monday kada moment mo Marcel 5 to 11 years old the Lomarus
President
baka mitra toktong malas tema ka abo delegat kana
President nga ka ang ngariya nga lagi kal sensei Ira Elementary School so lang mang dire kal kawan ngari ra sensei ko ra malkoy luase als ko mong waisel ko ra swadan mo open ra school ngariya ate al sabit tikal nga ra school ro kuil mo tested lang you never know tikal nga no may sa community to kuni baluray ray el kukwa limu lapas sa tibar ng ngale ke libera school kukoyur tirkal pepil malube loy wilira sensei mang sigira ko raw sing sa el Bible test ra ngal ka rokuye minister raw era wol open a school mga kurati usil mo raw lang le ito mes ringil wasi kata makarang leirar elang ang arian positive lo mais trabalu.
Sulang ya delegate, undas tilang nga direct kag partner sel plan ra school. Nung sa edon mo omes ringil sel sugo mo mo start ra school ang pangarang at telele kay gidil testing protocol.
Presidente, udasura se lo stova gay se mal morabab, the reach ra peak. Igida sa edon mo entertainer tilang, lembeser tiagid. Di ora policy ra public health lo sa Malbonia imol gay sa close to close sa school malubendia. Hindi al make sense sa open Malbonia igam to close sa school let him repeat the process. Mo ang odol mo to mo sa gid ko sa also related to Marcel Tora testing ma di mlak ko being physicians was why bother. Adult soil test, obviously malungil at to relieve anxiety, high risk. Madingil wasa gim la expose. Hindi ko lang niya, for example, mass testing. So adult open testing, rabitara more, adult cook mal interested, wasa nga sa almo madingil among. Halgi adult stover say. Hindi public health told mambura mass testing. Ang ginang nga niya purpose was kung trial figure out the epidemiology tell blue or trial figure out ang run number. Hindi all make sense. Hindi siya gidal policy legal ela klinika na yano mle close because mlarian adal mloko close contact even though they're relatively asymptomatic. Nga ulagat tikal wasin sa bela adal COVID take care smell. Ito diluoy. May la question na say. Also kung let's apply school open ya piga di kamaran mo ba ang testa ta ngal positive kung nuto close up la school ang umda sa seguida gila la public health decide
tingin la open a school there are enough information at present. Gada oil trira Dr. Beam, Dr. Thane, masatyal behavior at alserok mong wangaran lang ngkang olaba graph lang. Mong madayak mundir kamaran morbab. Maldir kalaran morbab open a school ang mutun ready. By the assault talgib level off. Merokong mong dasok mong sabel mora school and aksaya ko. Ang erong tial Pfizer vaccine rangal mulmutrat imarkrit eto mu tuludub ringil mo 6 months ra March letrigay givya sabil direct direct vaccinated litiang malamol maringi makada subringi kulngit doni subringin butel tang irul sante the information dangara C4 kung hal mas kami mong dasok mong raong iral bodo kiungi hindi open a school al adil ko risky.
Dr. Hancock, Dr. Borstrom, the question was, do we open schools? And I think the response is we need to look at the data, we need to study it and make sure that it's the right time, because the policy question is, if you open schools and there's a positive case in the school, do you shut down again? Or can we say that, well, if there's a positive case, you continue school because it's just like the flu, and children are not as high a risk. So I think those are really the questions we need answered, and maybe the data up to this point, the recommendation is let's wait for the data. And I guess maybe you can share what the current data is. I mean, for example, Guam, our current burn rate, if you go tenfold, is higher than Guam. So Guam should be having anywhere from 1,000 to 1,400, 1,500 cases a day to be comparable to Palau. So we're actually, our case rate is much higher than Guam. and schools are open, right? So that's a question that we need to ask. Yeah, maybe you can help us with that.
Yeah, I think this is a difficult decision. Certainly, I think there's two sides of it. By having schools close, sure, you're going to slow transmission a bit, and the hope was, as you mentioned, to flatten the curve and hopefully prevent more hospitalizations. But on the flip side is, school is important. That face-to-face learning is important. There's a lot of good interventions that the schools are ready to put into place, kids wearing masks, those sort of things. And yeah, you can't, if you do decide to reopen schools, I don't think you can go back to that model of one case, shut down the school. The Omicron is so infectious, it's spreading throughout the community, that you would have to shift to a policy of, okay, yeah, symptomatic kids couldn't go to school, but you continue the schooling. I think the decision really is for Palau. I think our numbers, although they've kind of slowed down, if you look at, because of our some of our testing, some days are just at the C4, some are on the, involve the mass testing, we're seeing that it's still increasing. The 7-day average of cases are still going up. Palau now has a 7-day average per 100,000, or 7-day total per 100,000, which is what CDC uses to compare across the states. That's higher than any other state at this point. So you guys are moving fast. We haven't seen it start to deflect down yet with those initial numbers, but we could see over the next few days how it plays out. I don't know, Dr. B, you have any other good insights? Again, it's a difficult decision. I think it's a Palau decision, weighing the benefit of schools versus the benefit of trying to flatten the curve.
Yeah, just one short comment in that is, I think opening schools would be really dependent on being able to help families understand that they shouldn't be sending their sick children to school. I think that's part and parcel of opening the schools. It's so if a child was asymptomatic and even if they were unknowingly infected, that's less important than those kids who are coughing and sputtering. They really need to stay home.
Yeah, thank you. So I think it's clear. We'll wait for the data and when we reach the peak, let's look at the other side. So, I said for now, so me will close our school. I think everybody agrees to that. Huh? I see. Ahora, someone comment.
Yung president assume mol close a school. Then at the same time, the real girl vaccination the school. At the same time, look, about 11. Because about 11, suguma girl vaccine serial age group, moderate age group, actually a school from kinder all the way to PCC. Man, vamos a seguir el age group para saber el vaccine trial los para facilitar la school. Mas vamos a ver en while not in school, edo va vaccination rate till more vamos a open and they're ready at the same time, President.
Gibbons.
Sunang Presidente, kadamla arming saygali reaction trigal teru toktang rigide undasa mal bataut ma saygida lolgoringa delgatra blur orior. Mr. President, dirigal wana undasa Minister Education rigida dirigal alchumum namo swada mutul back to school. Kada dirigal lome saygal classroom rigide Ikamang Senator Tabal was a number angal school nga siya legal classroom at 25 or 31. Classroom may ga sila angal kalbo long legal siya legal classroom mal masaya kada. Ma if you wanna magira la Minister of Education o masing masing makarada continue tigal ngal ka school and they still kada the maintainer shell tell do ase mo takal sal mal mo kayo geda tolong le apodorulit na ate do bran ra school at 12 the rikla mang umna sa adir kaletia dir umna sa asbel ministry of education tiam na mo years tiam na 12 besel gan year round mang asbel rotate ang nga school siya kan makit kung hindi da maintain na di way galol ko doctors and so kala da oily malo mes sel pigam na mo start mo wala ministry of education na share up sa iyo dal cook system makaral nga kalbo school and din ta maintain na distance gid ma ingya umila flora school ma o tirak like le protocols nga in place sa ida ko adi yung tige Mr. Presidente.
Silang delegate madategi da ongit at sugumang malmol close sa school moringi schedule ra omarus yakada malolingit ra parents la sem ngoy titirang algin memrus yakadul mes sa kita al nga alkot tal moringi yang ngwadim la kalsal to ka parents may until maarya guys edim na talsil sa mokem dagel mlaringil dolap makadolingit ra sel sugong makadamut close sa school tal Sunday yang ani omarus ra ngal titirang algin memlorus
ese tarang bagay siya araba balada hospital masang ramrus adira na batokalat selbor selpa da kadam sa tarang medro ko dela magada tira mana la adra lula se bang mga hours me bolsel free up trigal adara hospital boloro evira ora la kan masang ramrus kami landim la ko bolsel temel agad al dira dule minister lo ase Ayel urus awal dimle 250 mandimle talsil sing modia kida dimle kada urus ma allocation amagi tadi do der sese te te gal solution ayel mail spoil irimlaria case gida no spoil ayel urus no te kadok ngem ngada dire kamal malera adra se dire gal through your miscellaneous ayel discussion kami rablu remember other server alir dem ga ors miu namek merder belau gida. So hopefully Thursday arrive. No next week at the Dorus. Okay. Es important del parte sea parents agiram tirana la sebo Dorus among dirigam mo amaklat car parents. Delegate Kulivert.
Ti sa information del presidenta ibin masumo kada open a school kudim tinggal bekla alwa se sira wearable close preda tercero Omicron. Ito ko na school dim show up a school. Especially all time blood spread tel ser. Kung meron sa muto man ito ko na school ya kalbo show up a school, open a school. Le ngaria na kami mga school Maristela. Era bolo spread tel ser. Ito asen middle one door the class, ikatlo class. Adim na kalbo school. Emalmol mi limlaw nga school. Elmuta. Sige ko sa school. True lang.
Pero kasi din sa case by case. For example, a high school, tigam na most of them na vaccinate. So kada dire ka lamas tira sa maybe wa high school higida na mo gyud lamas yeah. Malubang let's say a school ay maliga tigam na vaccinator ko ya latam ta I don't know higida ra dire ka policy siya do lamas help ra discussion. Sulang. Apa senator Sungino?
Kaya maldilas na president kudo ko ram amar krege sel lulukor niya Dr. Ostrom Angel Mediol at a pregnant lady and she was positive and she gave birth to a healthy baby. Ay gave baby na ko na positive uluk tuhol transil ginel terakta. Maulong dire kal gida ko expose ay gida ko positive التوب ده كتير ركت مرات على لوك تجيب المؤلة لك لا رمريل ونداس نقول تطلع لي جيت النقل ستيتمنت دي كلار اللي مراقوق سل ولد سولا هذا المراب لا إذا نداس كنت يوم قضال لو بالتدريج القوق مرني جل بس التبل ستوريس السودر بنكس kita dire kal girel terguk mo kargit ke lol to mar adra lo rings sulam
كده من البوينت لا دي رغل جير المغتقليل واسع ونسير هترتنا مغدر يغنى تألم المون يوين أي شيء دكتور يانو سأدك أي شيء من كده هل برا هذا الشيء لان جاي تير من داخل سال مال مو يميسندين جدر دي رغل كانتينو مقلات كرتيل واسع تو تل الأوروس لو أولن داخل سيسي تيارخت المريكان so Mansung nama wile speaker ngari amne samal muri ada close president dia mun lamo ai maklok kita watulak mal dimre masulil namorul suyang da do em sulang ra discussion ma tela ter class school kum da sai osim le soril gora armeng ser kami mau da swiu magiman mereng asulil giral sel support le ukatima ma close school another week upem monger kame mongoror kame senator sungino da serang ka soril ma school kita dri al simmer mang sulang total discussion sulang yes bo president ra senator no simmer speaker
Misaule presidente, mal misaule minister kong material terul toktang el man nangusu gidra tok toy diregal merenga sule la senatore doctor Cuartema doctor Yano agumral wasay mal blag takl mergid ndi bulu diregal dirgaran rirma akpay diregal olngite minister bolsebele imrelia programa el metob de ay say gay gidel toklumil experience el ngaringi ay oigel guk laldo doctor Yano wasingaria family dila ge ettelasme reatta arbe bila guktial ser ay ge diregal mosutrar adrabulur belon mo understand lo se o oiga de mosme renditarial mosme madia ya ditarro lele que so aklida ultirak laigel teletelel tial el covid el ngiangaringi el angmang aklot tutlela obem emphasize ay gel teletal dogiungi en subedel sob aklider terrakt adirek el traigel aigel ulgo ya senator cuartel girela servicio hospital blutel mal mo mesringi ma ases aigel servicio el melmol lolomol el agam close direk el mo mesra el disira toktang regmu manurs e mo mirtir aigel essential service lolomol malagam close de selm close en direk el mo kluange rablu direk aigel lolgo ya doctor Cuarteng moring aigel service emergency indi diak sib in mar hospital le kom close mai gegi de gadibel adil el al sils maklugo ge momesem blutol open ai gegi del essential service melagan tinyu el agam stop ege diregel kansun adra ablu ya e diregel el adomes aigal media aiga ya ol oidra ablu mak agulingit sen brenges ebom clarify el agbi aigal mediam lolmul el mrula raurengra al selablu le omgoigal media o reolobong gamiu en soba clear ditirgal media omodeng tirga enemy gelungil toy mangire del corrector tir mang bolsebe el klate el metod em correcta ge del misinformation ma misstatement del ngaraigal media nen klok tutlel adrablu amomdeng kerdire glo misra Facebook ma YouTube ettadingun ge del emol ma asal mlamad engul meru lil wasengadim ladlen covid ul ese ruletir adrablul momadakta ngungil leng dam saud dingungil lutel saud indi nga kamal mrenga sule me minister e mal gilung yarngum ko goltal ndial goltang tokol minister dikatara minister man lang support ra house mang mal mrenga sule la speaker ma adra house mal support ra magal may gigid lungil luror ya kilmutal kung malmering sulela doctor Yano o doctor Cuartel en tader belao e toktang mesela dutoy en mal mungil moreng srawa e gida moreng direk lonite president Miguel advisor tir ako tokora school polsbe de lo tir keltrir e district gagi del terul adrang bard melongo sugidra gagi del deita el sob aklidra tial girela kukskura blur belao malm sulang yang ka malm yang suli ro
Minister, Ma'am Sula, malungil meeting al sils. Kada tu kaka omesing tial misinformation maray rablu. At tomal na ingal losaw da leader sigiri lumara tial rakta. President ngani ang rer belau direct ngani bebir radio station sa edalo spe. To spe tir malage dulu dia program edo ara airtime regide tura al cele do eri. Ngani talent sa al belau sa edel mut amplifier a narrative tial tokoy. Sa edel mo tingin na Dr. Yano, ma Dr. Cuarte tigal terul ada dokter ng CDC. E o valor todo ng iyang rebelaw. Kada matangay ngariya ra tiakal sorry ra atau sa ra marat tokoy wala ba igal false tokoy to ra blu. Mingira del counter president. Dia ka sabi del erem el overpower mind mentality ra rebelaw. Ay ganger let is leaders national make sure right information about bulu. Kung kita ka presidente to ka talent nga radio station ma government utilize tire minister tungun mo na media explaining it mo gideng ako besing last week may lang na trigibel medio ada mangan na mo understand rin. Di tiar ko kaya Elizabeth el tobra tial Facebook mga rangeng ang mutel. Di regal kumese presidente si reporter hospital ito loya ngari sel imol tilo ko na kumese ngin telilian number ko na adiakan ngara kami minister. Siya mal siya sabi del mura ada PNC sim to kadut sige ngel adam no murub say boyo to do sige ngi kadut yo mes nging afan terngi presidenta awana tial ditirgal madura mediam na mo lola ba gidel loloido di presidenta kita kabelmente close Radra bulu orang sergide temelil tergide mau keluar mude kita counter tiagi de minister aku ndas seguida imol saya ula misinformation amra bulu oi mama presidenta mo lingitra presidenta senate la dia kalsal sibira ada senate rulindi mama ada hausa mo start session mo mga la mission news mama me masaudo tiagi de la tiria con tiria adra state kung malmsulang Dr. Yano ka Dr. Cuarte tinggal terul doktor ra CDC maka minister you have done a good job aktire ko dulu ring sa minister Victor last week no sa sila experience rin si talaman bekan bin sa toklad malungila sila sa Dr. Yano sila family ay gigit experience ay gigit ada blue bela rings mo blokatak ng kuman sulang president kom sulang peklan
madam tiklutan mana sulala Dr. Yano Dr. Bostrom Dr. Hancock Dr. Cuarte minister temu direkan mal lungin advisor kami orang sudah ada olvir auk terlil merten oger ager anytime presenta senate speaker memgodang ya teman muda dadu lengkau tutela yel uk advisor adrablu alta بتصير ده explain ما adrablu lo مل بلغتك المورتين مل لغل برا ندير جدا mal close to trela ul deswiu close to trela ta kaso es mo komam kodong e kadame katuk ada tu sulang ratel mauk next amo next week kadar mutter kada kaso es somya next week kadar mutter awila next week ukti the touch base adan dimu what is schedule in kiran sulang